All right, everybody, welcome to America's Mom. We are fortunate enough to have a 2-for-1 tonight, and you guys are going to be so thrilled to hear not only from Dr. Jeff Barke again and all of the amazing things that he's been up to since we first got to meet him and visit with him about this crazy COVID-19 pandemic, but his lovely wife, Mary Barke, is also joining us tonight. She is the Vice President of Orange County Board of Education and is going to have a lot to tell us, a lot to share with us tonight. So, Dr. Barke, I want to start with you. I was flipping through PragerU, and all of a sudden I saw your very knowledgeable, patriotic face right there and thought, wow. What just happened? Tell us how that all worked out. How did you end up on PragerU? You had so many good things to say. I had people sending me that video to help me understand why COVID cases had supposedly increased. So walk us through what's been going on.
Yeah, absolutely. So good evening, Colorado. Nice to be with you. We're coming here from beautiful Orange County, California. So I had the unique opportunity to sit down with Will Witt and do a PragerU video. It was a lot of fun. Went to PragerU out in the San Fernando Valley, and we tested Will on air too for COVID antibodies. So what we're seeing now is we're seeing some media manipulation of the data. And although certainly the cases are going up and we should be aware of that, what they're not telling you is that we expected the cases to go up. So remember that we locked down the economy in order to flatten the so-called curve. And the reason why we did that is because some of the healthcare systems, specifically in New York and for a time New Jersey and Seattle, looked like they were getting overwhelmed. So we wanted to reduce the number of people that were being exposed to the virus, ultimately getting sick from the virus, so there'd be capacity in our healthcare system. So we did that, and we did a pretty good job of it. What we're seeing now as we open up the economy is, of course, more people are being exposed. Therefore, they're coming down with the virus. Most people that come down with the virus either have mild symptoms or they have no symptoms at all. And we're also seeing an increase in the number of people with the virus because we're testing a lot more people. And when you test more, you find more. And then the third reason why we're seeing more people with the virus is, I don't know about you, but I was watching some protests and riots all over the country a few weeks ago, and there was literally hundreds of thousands of people that were being exposed to the virus.
You know, Dr. Barke, I know you're a medical expert, but you don't understand how smart this virus is. It jumps right over the rioters and protesters, and it only gets you on the 4th of July when you're out celebrating your nation's freedom. So exactly. I can't accept that.
So here's the other part that they don't tell you. You know, they talk about the second wave. The reality is it's the first wave for many states. So in California, for example, we got shut down extremely by our governor, and we had very few cases of COVID-19 as a result. So we didn't really get hit like some of the other states did, in specifically New York, for example. Same thing with Arizona. So as we open up California and we see an increase in cases, this is our first wave. It's not our second wave. And interestingly, and they don't tell you this, remember New York when it was getting hammered and President Trump brought in a Navy ship. President Trump sent in the Army Corps of Engineers to build a hospital in whatever one of the stadiums. Yes. Both of those products were barely used, by the way. So they got hit pretty hard. And what's happening in Manhattan right now? They're not really seeing an increase in numbers because they've already been blasted by COVID-19. So they're not seeing that spike. The places that didn't have the spike before are now seeing cases of COVID. What they're also not telling us, Sharona, is that we're a lot better at treating this virus than we were just a month or two ago. So the length of hospitalizations for people with coronavirus is decreased, and the transition from hospitalization to the ICU is also decreased. So there's a lot of good news mixed in with the scary stuff that the media is telling us. And unfortunately, they're only going to tell us the perspective of the data that looks really scary, when in fact, it's not as scary as the media makes it seem. Now, that being said, don't get me wrong. This is a deadly virus. It's killed a lot of Americans, and we need to be very careful. And what a healthy society does with something like this is we should protect the most vulnerable. And the most vulnerable are our oldest citizens, 65, 75 and older, especially those that live in nursing homes. The most vulnerable are those with significant underlying illness. Those folks need to be careful. But for the rest of us, if you look up the data, don't believe me, look up the data. And if you look at the CDC website, this is what I do. Google CDC, COVID deaths, age, and you'll get an age breakdown of the deaths from COVID. And if you look at it carefully and add up, pick your age range. If you add up, let's say age 15 or less, there's been only about 30, 35, 40 deaths in the United States in that age group. And if you compare that to the number of deaths from influenza, influenza kills a lot more kids than COVID-19. And even if you go back up on the age bracket up to 55 or even 60 and add up the numbers and compare that to the number of cases, you'll realize soon that in the younger healthy population, this is no different than a really bad influenza season from the standpoint of if somebody gets the virus, what's the likelihood that they could die from this? There's new treatments now that are very effective. If you get the opportunity to interview Vladimir Zelenko, he's put forward this protocol, the so-called Zelenko protocol, and he's got a lot of numbers from the patients that he's treated. I heard him interviewed the other day, and he said in the younger age group, if you're treated early, he defines early as within 5 days of coming down with symptoms, 100% success rate, meaning you have a 100% chance that you won't die. Even in the group that he treats that's at high risk, it's something like 98.6, actually it's 98.3% of patients in the high risk group that get this virus do just fine. And he's reduced hospitalizations, he's reduced death. He said that if the Zelenko protocol were available universally around the world, that the pandemic would be over. Then you've got Dr. Bartlett out of Texas that has come up with his own protocol, a variation on the Zelenko protocol, where he uses a cheap, older generation asthma steroid called budesonide. It's been around forever. It's available generic. He uses it with a nebulizer, like if you're an asthmatic and you have one of those machines where you can breathe in from a nebulizer. He does that, and he has a 100% success rate of preventing death. And then I just read today, there's an old Abbott Laboratories drugs called, Tricor. It's a medication that reduces lipids, reduces triglycerides specifically. I'm forgetting the name. And it seems to also help in preventing viral replication and reducing the lipid buildup, the fatty buildup that occurs in the lungs as a result of inflammation. Anyways, there's a lot of treatment protocols out there, but especially when you talk about hydroxychloroquine, it's a political drug and it's hard to find now because pharmacies don't want to dispense it. And there's not a lot of doctors that are comfortable with it because they're spooked by all the media that's been going on with it.
But you feel really comfortable and really confident making that recommendation. And I want you to know that we had an older gentleman over the age of 70 who had spent 2 weeks in the hospital. They were at their wits' end. They didn't know what to do. They gave him 2 days of hydrochloroquine. What do you know? He went home. And he's healthy, he's alive, he's doing fantastic. So it's all these things are so hopeful. They're opening up the doors of our freedom again. They're letting us know that we can get back out there and get back to work. So in Orange County, Miss Barke, you're the vice president of the Orange County Board of Education, and you guys are going against the grain by saying we want to open up our schools with very limited impact to the students on this crazy OCD, CDC recommendation policies on the kids. And Dr. Barke, if I'm just listening to you, I'm like, awesome, great, let's go. But in Colorado today, we just had a statewide mask mandate issued. And the fear model is alive and well here. And as you know, we're in an interstate compact with California for COVID. And so how do you justify, Mrs. Barke, wanting to open up your school district, wanting to get the kids back to school when there's this big, scary COVID-19 that's so bad, we have to mandate mask wearing on the populace?
Well, We've done some research. What we did was we actually held an expert forum at the County Board of Education. So I sit on the county board. The county board actually does not have authority to implement anything in our 27 independent districts, but they look to us for leadership. We're actually an appeals board. And so if something happens at your local district and you're not happy with it, your child is expelled or you want an interdistrict transfer, you come to us on appeal. We also oversee a $250 million budget. But as far as other issues, our constituents come to us and say, what are you doing about this? Why aren't you opening schools? You know, it happened when they had the sex stuff, you know, the new, and so every time there's a big issue, they come to us and say, what are you going to do? And we typically hold a forum. So this was no different. What happened was at our May meeting, I found out that our superintendent had been holding behind closed door meetings since April about reopening schools. And I said, wow, well, could the Board of Trustees attend? And he said, no. And I said, are you sure? No. And I actually asked him 3 times in open session, and he said, absolutely not. And I said, well, then I guess the trustees would just have to have their own, you know, very transparent meeting. And he said, well, fine. And so that's why we put together this meeting. We had the acting health director of Orange County. We had one of the supervisors. We had Joel Kotkin, who's works for Chapman University and is a big writer. We had Michael Shires from Pepperdine University. We had a psychiatrist, a child psychiatrist. We had a pediatrician. We had a hospitalist. We had a physician that's also an attorney. So we had this wealth of information. We had a former superintendent who just retired last year. We had an educator. So we had a ton of people, and each trustee was allowed to ask several questions. We developed a lot of information, and what we really found, and what's amazing is we let parents or community members come for public comment, and our constituents, the public, had done so much research. By the time the experts got to speak, they were like, wow, we are so impressed. These parents have really done their research, and they found that there's very little risk of children catching COVID. No child in Orange County has passed away from COVID, and it's much more dangerous to swim in a pool across the street. So, go ahead.
No, you're exactly right. We're hearing the same things here. And yet there is this push to shut schools down or else to open them only with the CDC restrictions. So how do you answer that? I mean, we are in a situation here in Colorado where common sense is not prevailing. The force that you guys are bringing with you is so encouraging. And I'm so excited for everyone to hear you talk about what you did in your school district. However, we feel that we won't be heard. And even with the Governor Newsom has done the same thing that our governor has done. So how did you guys buck that and do what you believe is best for the students? How have you guys how will you get around that mask mandate that your governor implemented?
Well, you know, there's a huge controversy, and we understand that tomorrow at noon, he's actually going to come out with a school policy. So a lot of people are very interested to hear what he's going to come out with. You might guess. But, you know, basically what we say is what we came out with is not enforceable. They're recommendations. But what we want to do is we want to equip our trustees, our local district trustees, the local superintendents, and the community with information to look at and take to their individual trustee at their individual district and say, hey, have you thought about this? Have you looked at this white paper? And we're happy to share it with you, and you can take it to your local districts. So that's what we feel in our leadership position. It's important for us to keep our constituents informed. And when we found out that we couldn't find out what was going on, I asked, could I even just Zoom and observe? And the answer was absolutely not. And so that's just what we did. And we passed the white paper 4-1. So it's out there, and it's a resource.
That's incredible. We're going to be tapping into that resource. Dr. Barke, wrap us up tonight on what is the next steps here for people who love freedom, who want to have their constitutional protections restored, and want to grow their kids up in a free America. What is your word to them?
You got to get out and participate. You got to follow America's moms, and you got to follow the Freedom Angels, and you've got to follow people that are out there and putting themselves out there. You can't sit at home and be silent anymore. You got to speak out. You know, our freedoms aren't free, and we got to work hard for them, and we got to push back against people that want to take them away from us. You know, I'm not opposed to people wearing masks, by the way, even though the science is very limited. But what I am opposed to is the government mandating that we must do that. Should be personal decision. It should be up to each individual to make a decision as to what's best for them based on the science and based on what they believe is right. And if you want to wear a mask, please do. But the government should not be mandating things like that. And the government should not be mandating the policies for each individual school district. That should be up to the school district, the parents, and the local constituents to make those kind of decisions.
Outstanding. Well, once again, you have rocked our world over here in Colorado. There were so many people excited and waiting to hear from you guys tonight. Mary, thank you so much for giving us your time and this encouraging message tonight. We will be capitalizing on that and sharing this with everyone, and especially your resources that you are going to provide for us. Every parent needs to know that they have more power than they're being allowed to utilize right now. We just have to do it. Nobody's going to give you permission, right? It's not going to happen.
Absolutely.
You just have to go for it. Well, God bless you. You both are great Americans, and I look forward to seeing where this road takes you guys. Here's to freedom, right?
All right.
God bless you. Take care.
Thank you. We'll talk soon.
Thank you all so much. All right. Bye-bye.